Good afternoon, everyone. Thank you for joining me today. So this presentation will focus on epilepsy treatment gap in low and middle income countries. And this project was carried out by myself, Professor Joni Viljani, and Professor Peter Passmore, and today I'm presenting on their behalf. So firstly, an introduction into epilepsy. Epilepsy has been declared as a major public health priority by the WHO, and it is one of the top 10 causes of disability in low middle income countries. And the term epilepsy treatment gap refers to the number of people with active epilepsy who have not sought biomedical services or are receiving insufficient treatment, or those who are receiving no treatment at all, expressed as a percentage of people with active epilepsy. And this gap is more than 75% in most low-income countries and more than 50% in many middle-income countries. So to put that into perspective, if you take 100 people with epilepsy in low middle-income countries, 75% of those people will never be treated for their epilepsy. So this scoping review had 3 aims, and these are listed here. So there are a lack of neurologists in many low middle-income countries, and the first line of treatment for epilepsy, anti-epileptic drugs, are not usually available, and they're quite expensive as well. Therefore, people have to rely on traditional treatments, and these traditional treatments can delay the use of anti-epileptic drugs and delay consultations with doctors and neurologists. And all of this has such a huge impact on the person living with the condition, such as stigma. So in this scoping review, we used a standard method. We used 4 databases, and these are listed here: MBase, Medline, Web of Science, Core Collection, and PsycInfo. The articles identified from these 4 databases were uploaded onto the Covidence Systematic Online software, and then on this next diagram here, you can see the Prisma diagram. So we included major study designs like systematic reviews, primary studies, all conducted in low middle income countries, and all age groups were included as well. However, we excluded papers that discussed verbal seizures. So at the end, we included 47 studies in the scoping review, and out of the 47 studies, 35 were primary studies and 11 were reviews, and there was 1 systematic review. So the data from these studies were extracted using a data extraction tool, which included information about the aims of that paper or study, the population and the concept and the context in which the study or paper was looking at, as well as the results of that paper or study. So let's move on to the results. So firstly, looking at accessibility to and affordability of treatments for epilepsy. Not surprisingly, we found that there was a lack of neurologists in many parts of the world. So one study found that there was 3 neurologists per 10 million people in low middle income countries, and some countries didn't even have any neurologists at all. And one paper suggested that there is a lack of neurologists in many parts of Asia due to the high cost of setting up training facilities, specialist training programs, and also difficulties in retaining graduates who completed training abroad. So there was a lack of neurologists, and in terms of the drugs, only first-generation anti-epileptic drugs were available, and usually they were quite expensive. So we wanted to understand that a little better. On the right there, you could see a graph. So we mapped out countries that provide governmental grants or programs to assist their population to purchase anti-epileptic drugs. And as you can see, most of the graph is, the map is grey, so not a lot of countries do provide help with their population with anti-epileptic drugs. So people are not able to purchase these anti-epileptic drugs, so they have to rely on traditional treatments. With this concept, we identified 2 themes: social and psychological implications of using traditional treatments to treat epilepsy. So firstly, starting with cultural beliefs. In many parts of the world, in many parts of Africa, it is believed that epilepsy is a uniquely African phenomenon, and therefore non-Africans are therefore unfit to treat people with epilepsy. And people believe that traditional medicine can cure epilepsy, whereas modern medicine can only treat epilepsy depending on the cause of it. And some people believe that traditional medicine is safe and effective. However, that might be quite incorrect. For example, seed that is contained in many herbal remedies contain a neurotoxin that can promote seizures in a patient. So all of this has such a huge impact on the people living with the condition and their family and their communities. So similarly, we identified 2 themes within this concept: social and psychological implications. So firstly, starting with causes of epilepsy. In many parts of the world, people believe that epilepsy is caused by various different reasons. In Morocco, 37% of general population believed that they saw that epilepsy was a serious health condition, whereas others believed that it was a possession by evil spirits or mystery. And all of this has such a huge impact on a person. So many children, a study that was conducted in Sierra Leone found that a large number of teachers in Sierra Leone felt that pupils with epilepsy shouldn't take part in physical activities. And some teachers even requested their pupils not to attend school until they were cured of their epilepsy. And as you all know, epilepsy cannot be cured. And this will have such a knock-on impact on that child, their ability to get education, and in future, ability to get employment and live a full and normal life. And coming back to the person living with the condition, many people with epilepsy felt that their epilepsy was caused by evil spirits and epilepsy was contagious, and they believed that it was as a result of their past actions or karma. And as a result, they felt like they were a burden to their family, and many of them withdrew from friendships and relationships. So moving forward, what can we do to advance this research? So we could look at specific geographical regions. So our study found that there was a large epilepsy treatment gap in Southeast Asia and Africa, and other studies have shown that too. So it would be very interesting to look at these specific regions and understand why there is such a massive treatment gap. And secondly, we could map the prices of major anti-epileptic drugs across a range of different countries to better understand the issue of affordability. And thirdly, we could look at other countries that have, other low-middle income countries that have successful programs to help people purchase anti-epileptic drugs and explore this issue further. And finally, the potential strategies that we can implement to reduce epilepsy treatment gap. Firstly, we need to increase the workforce, so train more neurologists and primary healthcare workers. As you can all appreciate, training neurologists will take many, many more years, and it won't solve the problem directly. So meanwhile, primary healthcare workers can be trained to manage epilepsy and treat epilepsy at the community level. And the WHO has been carrying out pilot projects in countries such as Vietnam to train primary healthcare workers to manage and diagnose people with epilepsy at the community level, and it has been shown to be very, very effective. So this could be one of the potential ways that we could implement to reduce the epilepsy treatment gap, especially in those regions that are, for example, Southeast Asia and Africa, where this gap is, this gap is much bigger. So as well as having more workforce, we need to ensure that people get access to these medications, and these medications are both affordable and of good quality as well. So interestingly, one study conducted in Vietnam found that 65% of major anti-epileptic drugs sold in Vietnam were of poor quality. So we need to have more healthcare workers and more medications available. And thirdly, we need to improve the lives of people with epilepsy and their families and communities. So we really need to engage with local communities to reduce stigma. Stigma surrounding epilepsy and associated with epilepsy is still present to this present day, despite the numerous efforts of the past century. So we really need to engage with local communities and other stakeholders to reduce stigma, to ensure that people with epilepsy have the same opportunities in life as their peers. And finally, we need to address the use of traditional medicine. Many people still use traditional medicine, maybe because they might not be able to access anti-epileptic drugs, and there could be an argument that some traditional treatments might be effective, whilst others might not be effective, but they generally do delay people's access or use of anti-epileptic drugs. So if people are not taking anti-epileptic drugs, which are shown to be effective in reducing seizures frequency and severity of seizures, this means that seizures can happen more often, and seizures can have devastating consequences. For example, physically, people can have physical injuries, and socially, people can lose might not be able to work, or maybe not able to drive. And psychologically, people might, patients or people might not have lack their self-confidence and self-esteem. So just to conclude, epilepsy, as there are several reasons why epilepsy treatment gap still persists to this present day, and we looked at a number of few, but there are many more reasons, and these factors deny people the treatment they need and deserve. And together, I think we all need to work together across different countries to ensure that no one is left behind, and people get the treatment that they truly deserve. And that's the end of my presentation, and thank you for listening.